I'm sitting here today with William, and William, you were in just a little over a year ago. You were having quite a bit of hip pain and some low back pain, and actually we did a full body stem cell makeover with you.
Correct.
So do you want to just tell us a little bit about what your experience was before we did our treatment a year ago, and then how you've been since?
Well, before I've always been an athlete, been an active person, and I went through a couple of knee surgeries, had wound up with left knee replacement. I was becoming debilitated because I wasn't able to function physically, and I've been researching. I actually had a stem cell procedure on my knees from another physician earlier on, and I learned from that you have to rehabilitate the knee, and I didn't rehabilitate it without get on it, and there's no way for the new tissue to grow if you're pounding on it every day. And so that was not successful, but the right knee was successful, and so I started researching it more. And my son has a vacation home here in Park City, and I read Ben Greenfield's book Boundless, and in that section there was a section on Dr. Adelson, and I watched some of the YouTube videos, and then I said, well, that's right what I'm looking for. And it turns out that Dr. Adelson's right here in Park City where my son has a vacation home. So I immediately called and made an appointment, and I was in pretty bad, I was really getting almost depressed with my lack of being able to function physically, actively, and like hike in the mountains and do the things that I've always done, even though I don't play basketball anymore. Obviously, I'm 75 years old, but I really wanted to fight that, and so it was a combination of being physically debilitated and then the aging process. I said, hey, I'm going to go for it, and so I went for it. And a year after the procedure, I started I wouldn't say compared to other patients who's really high pain. I wasn't a high pain person. I was just tight. I hurt all over. It'd take 20 minutes to stretch before I got out of bed in the morning. A year later, I sometimes forget to stretch when I get out of bed in the morning. I can squat to pick things up off the floor. 6 months ago, I would pick something off the floor, and my right hip I had to get like a knife, somebody stuck a knife in my right hip. And it would go, but gradually it got better and better and better, and now I'd say if the scale of problems was an 8, it's now 3.
That's wonderful. So put another way, if you had to pick a percentage improvement, what would you say you've had?
Oh, I'd say 70 to 80%.
Oh, that's wonderful. Yeah. That's wonderful.
Yeah, 70 to 80%.
Oh, I'm so happy for you.
And of course that affects me mentally and emotionally, and then I give credit to Dr. Amy Killen a little bit, because she did my scalp and my face, and I just was at the hairdresser about 4 weeks ago, but she was remarking, again, I'm 75 years old, and I've got a full head of hair, and my hairdresser says, what are you doing? Your hair is thicker than it was a year ago. And so kudos to Dr. Killen.
That's wonderful. I'm so happy to hear it.
I've got results there too. I'm still working on the testosterone part of it. I actually did that part, and I'm still working on that. But that may have to do with some medications and things. But everything is just so much better.
Oh, I'm so glad to hear it. Well, today we're just going to do a little tune-up with some vsel, and hopefully get you the rest of the way there.
Yeah, I'm looking forward to it.
That's great.
Thank you.
Thank you so much.